Welcome back to the channel. It's Dr. Durst. If you don't know me, I am a traditionally trained MD that now specializes in regenerative medicine with a focus in sexual medicine. That focus in sexual medicine is because there is a huge gap in medicine related to sexual issues, and it's a growing part of my practice and happens to be a passion of mine. Today, I wanted to talk about the top 5 signs of ED. What is it? What are the risk factors? What are the traditional treatments? And what are the regenerative treatments that can be offered? So ED, it's hard to get accurate stats on ED because frequently it is underreported. Many men don't seek treatment, and many physicians do not report it or open those conversations. Approximately 7% of men are actually receiving treatment, yet approximately 52% of men in the US between the ages of 40 and 70 have ED, or what technically would be considered ED. So that's a huge number. So what is ED? So if what you're experiencing as far as erections are bothersome to you and sex isn't satisfactory, right there, that's ED. Because your mind is thinking about it and you should have a happy sex life and shouldn't be focused in on the inability to consistently get an erection for sex or persistently and consistently maintain an erection throughout sex. But the other thing that men frequently complain of that also is ED is the inability to have an orgasm. So there's a prolonged period of time where they can't have an orgasm or maybe lose an erection before they have an orgasm. That's a decreased sensitivity, and that also is ED and leads to a dissatisfaction with your sex life. So what are some risk factors? The penile vessels are 1 to 2 millimeters, the smallest vessels in the body. So that is a barometer of vascular health. It happens before cardiovascular disease, coronary artery disease, stroke, carotid artery disease. So if you have high blood pressure, diabetes, high cholesterol, or if you have cardiovascular disease, have had a previous heart attack or stroke, then that is a sign that your penile vessels, which are the smallest in the body, are also affected. But that is the first thing that usually happens because they are the smallest vessels. But you can also have neurological conditions that lead to it. You can have diabetes, which also leads to the vascular condition, as we discussed. Cancers can cause it, bladder cancer, prostate cancer, surgeries related to it, although those surgeries are better than they've ever been as far as minimizing your risk of ED related to them. Medications, another thing that patients don't think about, high blood pressure medicines, anything related to sleep or an antidepressant, antipsychotic, sedative, any of those, but also lifestyle. So we are frequently combining the patient's part of the journey to better erections, which is changing lifestyle. So if you don't have a healthy diet, we're talking about that. Also getting more fit, not smoking, and again, any kind of illicit drug use. And then that's a journey with us to provide those regenerative treatments. And along with the patient who is improving all their lifestyle habits, we can get you better erections. What is traditionally offered in medicine? So basically, if the conversation is open, the traditional doctors are usually offering you some medications, the little blue pill, that will increase your blood flow. But it isn't getting to the root problem, and those penile vessels are affected and the blood flow is not healthy. 80% of the time, 20% of the time it's hormones. But again, the older you are or with any medical conditions, the higher component of blood flow that plays a role. The next step with primary care doctors, if the little blue pill isn't working, is that potentially you can use injections, and you can also have penile implants done at a very severe ED level. But in between there's a vacuum erection device that can be used if it's offered, and we actually use vacuum erection devices as part of our regenerative treatments. So what do we do in practice? this. Again, we're evaluating. There is a scoring system that you can do. We have other videos related to the scoring system, but opening those conversations is the first thing you need to do. Secondly, putting a objective number to it, or a SHIM score, the International Index of Erectile Function, the IIEF or SHIM score, gives us a good starting point. Where are you? And then based on your medical condition, your age, what you can do in and out of the office, we'll come up with a treatment plan that's comprehensive. That includes, again, lifestyle changes, hormone optimization if we need it, and then regenerative treatments that are more localized treatments to help increase blood flow and get better erections. That includes acoustic shockwave treatment that is communicating with the tissue in the penis, in the perineum, to increase blood flow and nerve regeneration, and then also injectable treatments with PRP or a P-shot, where those platelets that we get, we draw your blood, spin it down, get platelets. Those platelets have growth factors, many of them, and re-inject them into the penile tissue to get increased blood flow and nerves and sensitivity. It's all regenerative, doesn't involve medications or surgery, highly effective in studies. And again, it's a comprehensive treatment. The patients have to do their part. And it's a journey between us and you. If you're questioning whether you have ED, it's a good chance you need to bring that up with a physician so that we can do more objective scoring and decide what's right for you. We have done lots of videos on this. If you have any questions, let us know. But in our opinion, you can get better erections. You have to do a comprehensive treatment related to that, but you have to know the options are available and open those conversations with your doctor, because I strongly believe that a happy life is a happy sex life, and everyone should have a happy and joyful sex life. So let us know if you have any feedback related to your primary care doctors, conversations you haven't had, conversations you have had. I would love to get your input. And again, I'm willing to deep dive into anything sexual wellness. Thank you.